Okay, discuss some questions um, regarding our topic and the other relevant topics. So, an 18-year-old gentleman presented with excessive bleeding following a tooth extraction. So, his investigation showed platelet count normal, prothrombin time normal, APTT activated partial thromboplastin time is prolonged. Factor VIII is normal. So the question is, which of the following factors, okay, deficiency of which of the clotting factors or the following clotting factors is the most likely explanation for this patient? Okay, please select one option. 2, 5, or 7, or is it 9, or is it 10? So, deficiency of which of the following is the most likely explanation for the readings that we see here? Platelet is normal, prothrombin time is normal, APTT is prolonged, factor VIII is normal. So the answer is D, which is factor 9. So why? So firstly, we have to know that raised APTT, okay, APTT as we mentioned is the longer pathway, starting with factor 10, 11, 9, 8, sorry, factor 12, 11, 9, 8, 10, 10, and then 5 here. Then, so from factor 10, and then we have factor prothrombin to thrombin, thrombin converts fibrinogen to fibrin. Then we have factor 7 on the PTT part. So a raised APTT could be due to treatment with heparin, can be due to hemophilia, can be due to von Willebrand's disease, antiphospholipid syndrome. So, and we see that there is a normal factor 8. So a normal factor 8 would suggest hemophilia B, since that there is a lack of factor 9. So because we see that the factor 8 is normal, so the problem is most likely factor 9. Even though we might see a prolonged APTT in von Willebrand's disease, but we will expect factor 8 activity also to be low, which is not the case in this patient. So in this patient, factor 8 was normal. So in von Willebrand's disease, we expect factor 8 to be low. And this patient's presentation is not in line with antiphospholipid syndrome, okay, which usually is associated with thrombocytopenia, which is not seen in this patient. It was not seen in this patient. See, the platelet count is normal, so there is no thrombocytopenia. So let's go to the next question. A 15-year-old boy presents with hemarthrosis, okay, so which is accumulation of blood in the joints, in the joint or joints. Hemarthrosis, so there is a singular hemarthrosis in the joint. So developed in his left knee following an injury. So his platelet count is normal, PT is normal, APTT is prolonged, and then factor 8 is normal. So which of the following is the most likely diagnosis? So this question is quite similar to the question before this. So is it antiphospholipid syndrome? Is it antithrombin 3 deficiency, hemophilia A, or is it hemophilia B and von Willebrand's disease? So again, an increase in the APTT could be due to heparin treatment, can be due to hemophilia, can be due to von Willebrand's disease, and can also be antiphospholipid syndrome. So the normal factor VIII would suggest hemophilia B. In which we will see a lack of factor IX. And then again, as in the previous question, it is mentioned here that a prolonged APTT can be seen in von Willebrand's disease. But then we would expect a factor VIII to be low, which is not the case here, because the factor VIII is normal and it's not low, which is what we expect in von Willebrand's disease. So in von Willebrand's disease, if we expect a low factor VIII, and then again, this is not in line or not consistent with antiphospholipid syndrome, which usually will come with thrombocytopenia. So you see there is no thrombocytopenia in this patient.